we are going to discuss the remaining part, that classification of ADR. Classification of ADR, as we have seen, see, ADR can be classified based on their onset of event, then types of reaction, severity, and based on some other factors also. Here, let's discuss based on types of reaction. So here, type A, B, C, D, E, F, G, H, U. A means augmented, B means bizarre, C means chemical, D means delayed. Type E indicates exit or end of the treatment. F means familial. G, genotoxicity. H, hypersensitivity. And the last one is type U, unclassified. Let's see what is type A, that is augmented reactions. The reactions which can be predicted from a non-pharmacology of a drug. Here, see, the reaction can be predicted from the non-pharmacology and it will be absolutely dose dependent and it can be elevated by dose reduction. What does it mean? It can be reduced. The symptoms can be reduced when we reduce the dose as well. Examples, anticoagulants. If we use anticoagulants, the possible ADR is bleeding. So when it comes in case of beta blockers, it is bradycardia. When we take nitrates, see, chances of having headache is normal. Prazosin, that is postural hypotension. Now let's see some toxic effects. What is toxic effect? It results of excessive pharmacological action of a drug due to overdosage or prolonged usage. See, if we are taking a tablet or any syrup, anything it can be, if we are taking any drugs, that too for a prolonged period or in an overdosage, it will cause an excessive pharmacological action. And overdosage may be absolute, that can be accidental, homicidal, suicidal. A relative is also there, like gentamicin in renal failure. So it results from, first one, extension of therapeutic effect. Example is barbiturate, which causes coma. Digoxin, that is complete AV block. Heparin, bleeding. Second one is functional alterations, that is atropine causes delirium. Third one, drug-induced tissue damage. Then paracetamol, as we all know, if we take paracetamol, it can cause hepatic necrosis. Now let's see what is intolerance. Appearance of characteristic toxic effect of a drug in an individual at a therapeutic dose is known as intolerance. Converse of tolerance, that is, intolerance means what? When we cannot tolerate something, that leads to intolerance. That is known as converse of tolerance. Then indicates a low threshold of an individual. Let's see some examples for intolerance. See, triflupromazine. When we take it as in single dose, it can cause muscular dystonias in some individuals. Like that, carbamazepine, its few doses can cause ataxia in some individuals. Like that, chloroquine, that is a very single tablet. It can cause vomiting and abdominal pain in some individuals. Now let's see what is idiosyncrasy. Genetically determined abnormal reactivity to a chemical, that is known as idiosyncrasy. Certain bizarre drug effects due to peculiarities of an individual for which no definite genotype has been described are also included. Then drug interacts with some unique features of the individual not found in majority subjects, and it produces uncharacteristic reactions. Like when we take barbiturate, it causes excitement and mental confusion in some individuals. It is not same for everyone. It can happen to some individuals. Quinine, that can cause cramp, diarrhea, asthma, then vascular collapse in some individuals. Like that, chloramphenicol, it can cause aplastic anemia in rare individuals. Where in case of drug allergy, immunologically mediated reaction produced stereotype symptoms unrelated to pharmacodynamic profile of the drug, generally occur even with very small doses. And it is also known as drug hypersensitivity. So drug allergy, which is also known as drug hypersensitivity, there are type 1, 2, 3, 4. 4 types are there. First one is type 1. It is immediate and anaphylactic, that is IgE. Example, penicillin causes anaphylaxis. Type 2, cytotoxic antibody, IgGM and IgM. When we take methyl dopa, it can cause hemolytic anemia. Type 3, serum sickness, IgG and IgM. Antigen antibody complex. Example, procainamide induced lupus. Type 4, delayed hypersensitivity, that is T cells, which can be what we can give it as an example, contact